A very good evening to all the students who have been waiting patiently to attend to the session. We at DocTutorials welcome you, all the FMGE students, for this special session we are going to have where we'll be discussing important strategies for the last 1 month revision if you are sitting for the FMGE exam. I am Dr. Sandeep Sharma, pediatric faculty for DocTutorials regarding NEET PG and FMGE exams, and we have three doyens in the field of FMGE preparation with us today. We have Dr. Khaleel Ahmed, he is the radiology faculty. We have Dr. Rajiv Dhawan, he is the ENT faculty, and we have Dr. Mohammed Azam with us, the popular, ever popular anatomy faculty with us. So in this session, we are going to take up some of the common doubts that you students must be having regarding what you are going to do over the next 1 month and how you are going to, get those 50% mark at least and cross over, and you don't have to sit for the FMG exam again, and maybe you can start planning for the life ahead. So let me start with, first of all, Dr. Dhawan. Sir, can you just enlighten the students about what are the basic principles they should keep in mind when they are preparing for the next 1 month? Because the exams are just about 1 month away.
Thank you, Sandeep. Dear FMG friends, welcome to the session, and sorry for the delay, first of all. And let me divide this 1 month now into two parts. I would take up from today to 27th May first, and later on I will talk about the last 1 week. As I always keep saying, that last 1 week is the last look time, and 28th May to 3rd of June, what we're doing, I'll discuss the later part. So let me focus right now on the timing till 27th May. Now, first of all, guys, your notes are the principal thing. Trust your resource. That's a very, very important thing. Whichever boat you have kept your feet on, trust that. Number two, do not keep on changing your strategy every now and then. This word strategy is a very, very, I would say appealing thing, because we want someone else to tell that which subject need how much time. But what I would like to tell you honestly, you have been following a strategy as per your, whatever curriculum you are into. Let us stick to that. There are a couple of things I would like to add on to that. What is that? Guys, please be quick in your revision. When I say quick in revision, sometimes we take pretty long time to revise certain things, and our target was to finish almost half of anatomy today, but at the end of the day we say, oh, we couldn't just finish upper limb only. So that is not really going to really yield too much of things to us. Let us go number one, quick. When I say quick, every page of the notes, teacher would have told you, oh, this is more important point, this question has been asked, or this can be asked. So that story is more, worth revising at this moment now. So there's certain couple of parts or notes which faculty would really make you write down to sort of build the concept. If you have the concept, trust it and really move forward now. Now, when you do revision now, you have to do one thing. There'll be a couple of things in your notes in all subjects which are very high yield. Number two, which are very vulnerable to be forgotten. And you also know that if you don't see them in the last 1 week before exam, let us mark them with a single color pen. Pick up any color, whatever you like, just mark that with a bracket or a circle or something like that. Out of one copy of maybe 150, 200 pages, you should have these islands shining now. Why? These islands will be utilizing in the last 1 week. When we know that, okay, last 1 week is still coming up there, we can do this revision quicker. Number two, focused revision. This is very, very important. Guys, at this point of time, your mobile phone should be mostly switched off. Mostly means mostly. I know there's academic value of the mobile phone at this point of time. You should just use that for maybe you are getting some academic information or telegram or something like that. Keep 1 hour after dinner for that. That's all about it. Let your brain be fully available for revision. Why? Because now whatever you are going to revise, there is a high probability that if a question comes out of that, we'll be able to recall that. And then in the last 1 week, we're going to really touch that again also. Now, let me come to the third thing. The third thing is, there are couple of parts of the notes which are damn difficult. Like for me, like I can tell you, acid-base balance will give me palpitation right now also. So I have not been able to revise acid-base balance since the time I attended the class. Now, if I want to revise acid-base balance, it's going to take me like around 3 hours or 2 hours and all that. I don't think I can really afford that. Guys, do some questions, see that part retrospectively and move forward. It's very important to have a strategy. Guys, it's not about hard work, it's about smart hard work. Now, let me come to one last point which I like to reiterate for all of you. Guys, please try to do 2 subjects in a day. 2 subjects means pick up a challenging subject and pick up an easier subject for you. Why I'm saying this combination? At the end of the day, you should feel that I have been having a productive day. When you take a challenging subject, you want some breather. Let us pick up a simpler subject. For example, you're doing surgery in the morning and your surgery is challenging for you. Let us do subject like maybe dermatology or maybe ophthalmology or ENT or whatever you like. Do that part. You get an accomplishment, and this accomplishment is going to keep us, very, positive about it.
Thank you so much, sir, for your kind inputs regarding how you are going to plan out the strategy. Now, there is another question which will be popping up in the minds of a lot of students right now. Like, Khaleel sir, I'll come to you. Like, suppose I'm a student and only 1 month to go, and I have done only 11 or 12 subjects properly at this moment. So, being a student, being particularly in FMGE, I will be in a dilemma. Should I be focusing and revising and consolidating those 11, 12 subjects, or should I aim to cover the remaining subjects which are there? So, sir, please enlighten students on that.
Yeah. Sir, a very valid question, and most of our FMGs at this point of time have that question in their mind. What I would suggest is, please understand, it is important to do 19 subjects. Whether you like it or not, make it a point that we cover 19 subjects. We never know which subject is going to give you more questions on this exam, right? So sometimes opthal gets a lot of questions, sometimes pediatrics gets a lot of questions. So you don't know which subject you may leave, and that may be crucial for your results. So what I would suggest is, obviously, yes, within 1 month duration to study all 19 may not be practically possible, but you should develop a strategy to see that you smartly cover all 19. If you have done 12 subjects thoroughly, I would suggest you stick to your primary source, whatever you have put in efforts and learned. But when you're revising these 12 major subjects that you have already done, please follow a strategy that when you're beginning, don't begin like with the first chapter with the anatomy. For example, you're revising OBG and gynecology. Don't just start with first line and try to read the anatomy only for half an hour, 1 hour like that. By the time you have done, by this time you already must have seen the discussions in the classes, okay, the faculty discussions and the exams that you have attended, the tests that you have written. You know that which topics are important. You know that antepartum hemorrhage is important, postpartum hemorrhage is important. So instead of focusing a lot of time on your anatomy, do skim through these chapters, but wherever you get the high yield areas, slow down, revise with lot of thoroughness. So cover those subjects that you have already done in this fashion from your original source of preparation, rather than skipping the notes completely and going only retrograde. I would suggest for the subjects that you have done well, use a strategy that you skim through your notes. The areas which are less relevant, you just go through that just for the psychological satisfaction. But whichever you feel is a high yield area, slow down, put some effort, see that you're memorizing it before you go to the next one. As far as the subjects that you have not touched, to open up now and do the entire notes may not be practically possible also. A good strategy would be to frame a retrograde approach for these subjects. So you should decide, okay, which are the subjects that I'm going to do mainly from my notes, like from my main preparation source, and which are the subjects that I'm going to put in retrograde. And most of questions will be some very standard questions that you can easily answer by just doing some retrograde previous year questions and some important, very, very straightforward questions. So by being regular with your approach, with fast track revision of your main subjects, with retrograde approach to your short subjects, focusing on like all the high yield topics, all the high yield MCQs, you definitely will get 50% of the questions which are very, very straightforward from those topics. So instead of not doing those subjects completely, please focus that you do all the 19 major ones that you have already done in a proper fashion, and plan a retrograde revision for the other subjects. And don't look for an ideal revision. There is nothing called as an ideal revision, guys. You will never be able to do it in a strategic and a very slow and a steady manner. Plan for multiple revisions. See that you start your another revision in the last 10 days or last week before. So try to balance it that way. So as sir mentioned, Rajiv sir has mentioned that to increase the speed, that would help you to have a second part of the revision also well.
Yes, perfect. If I may add one thing actually, Dr. Khaleel really beautifully said that you need not to be perfect to pass this exam. That's the I would say tagline. Please really learn it from my experience. That in my PG preparation days, my biochemistry was very, very weak. I did it retrospectively, and believe me, out of that retrospective, even last year question and all that, I could gather 3-4 questions out of the 10 questions, sir. Which really, really helped me in the exam. And let me tell you, beta, this is screening exam. The mandate of the exam is to know sufficient enough to pass the exam, not everything but everything. So even if you are feeling that, or your heart is saying that you are not properly prepared for all the subjects, as sir has guided beautifully, let us revise our the strongholds. Let us do certain things which we are weaker at retrospectively. Okay.
Very well put. Very well put by both the experts here. I'll come to Azam sir now. Sir, there is always a query, another query students have in the last 1 month, that now only 1 month time is left. Should I be focusing on revising my notes, or should I be solving some MCQs for practice, or should I be giving mock exams? How to strike that balance, sir? Sir, any input on that, sir?
Absolutely, sir. A very warm welcome to all of you, my friends. Now, first of all, like this is a very commonly asked question by most of the students, that shall we go only with the notes in the last moment, or even we have to solve the MCQs? I would firmly tell you that solving MCQs is extremely important in this last few days of the exam, in preparation, guys. Why? Because just revising the notes, learning the theory part is totally a different thing. And when you solve the MCQs, when you see one question with 4 options, your mind starts working in a different manner. When you see the 4 options, you have to still think comparatively between the 4 options. So that's the reason why I would firmly tell you that you have to solve the MCQs daily basis in this last few days. And I'll tell you one very important guru mantra. Do one thing. Please solve the MCQs at the same time when you have your exam. For example, on 4th June you have your exam in the morning time. So morning 1 hour, like 9 a.m. like that, you just keep for solving your questions, so that your mind is mentally prepared to solve the MCQs at that particular time itself on a daily basis. That's a very important thing, very important strategy. Now, second thing, apart from this, I have seen like most of the students in solving the MCQs and all, they'll have a phobia of giving the subject-wise test as well as giving the mock test. I would like to say you people that don't shy off from like whatever result you are going to get after giving the exam. I want you all to write down the mock test, whatever the result might be. Why? Because when you write down the mock test, you'll get to know so many of your weaknesses. For example, number 1, time management, the most important thing. I have seen n number of students after writing the final exam coming back with the feedback, sir, we were not able to solve last 20 or 30 questions because time was not able to, I was not able to manage the time. So time management you will learn when you solve the mock test. Number 2, when you solve the mock test, when you solve the questions, you'll come to know whether a particular topic you have completely left, you have not learned that topic. Or number 3, you have learned that topic very well, but you were not able to revise in the exam or not able to recall in the exam. And number 4, the silly mistakes. Okay, you know the topic very well, you revise the topic very well, and yes, it was very well recalled in the mock test also, but still due to some anxiety or some tension during the exam, you were not able to answer it correctly. So these 4 things you will get to know very clearly: time management, recall of the topic or the topics you did not study, and the fourth thing is that like silly mistakes, you did not read that except all perfectly or something like that. So all these things you will train yourself when you write down the mock test. That's very important thing. So please, I request all of you, don't leave the mock test. And then there is a third thing I would like to convey to all my friends who are going to attempt the exam, that after writing the mock test, I have seen like 2 category of students. Suppose out of 300, if you get like 200 plus in the mock test, you're like very happy and you will leave the remaining 100 questions. And I have seen the second category of students, after writing the mock test, out of 300, if you just get 100 plus marks or 80 marks or 90 marks, whatever it is, they're like very sad. So I want you all to tell one thing: don't be like very happy, don't be very sad. Whatever your result might be, you should be always concerned, okay, what happened to my remaining questions which I was not able to answer. So post-exam analysis is very much important. Even you are scoring very good, whatever little bit of questions are left out, why I was not able to answer that questions. So I want you to analyze post-exam. That analysis is very much important. Why? Because don't take the mock test or subject-wise test like something deciding factor in your life. It's a part of your preparation. That is the main important point which I want you to convey. Just reading notes merely and just going through the theory always is not only the preparation. Solving MCQs and even writing the mock test and post-exam analysis is very much important. That is also a part of your preparation. You are mentally preparing your mind to solve the MCQs, guys. Now, saying all this, I'd like to come back one more thing, guys, which most of the students have asked. I would like to ask, like, Sandeep sir itself. Okay, Sandeep sir, can you please tell me, like, what is the importance of solving, like, previous year questions? Most of the students were even asking about that one also, sir.
Thank you, sir. See, my take is very simple. Think of your exam like a battle. When you are going to fight your enemy in the battle, you need to know about the strength and weaknesses of your enemy, and what better way to know your enemy than to look at the way your enemy has fought in the past. That is what we are talking about, the previous year questions. They are actual questions which have been asked in the exam. See, you need to understand that exact ditto repeat of previous year question is not going to happen. Even if it happens, it is like a slice of luck. Good luck to you. But what we normally see is that about, if you look at the entire paper, about 30, 40 or even sometimes up to 45% papers, questions are topic repeats. I'll give you a simple example. You can do a small exercise by yourself. If you look at the last 5 or 6 year papers of FMGE in pediatrics, there is a question, there is a topic called as tetralogy of Fallot. Now, tetralogy of Fallot, one time they asked all of the, which among the following is the most common cyanotic congenital heart disease? The answer was tetralogy of Fallot. 1 year later, they asked cardiothoracic ratio will be normal in which among the following congenital heart disease? The answer again was tetralogy of Fallot. Then 2019, they asked about which among the following is not a component of tetralogy of Fallot, and 4 components were asked. One of them was the wrong answer, and it was the odd one out, and it was the wrong answer. It was the correct answer. So what it means is, when you solve previous year questions, you come to know that tetralogy of Fallot is a topic from where questions are being asked again and again. So you not only practice your MCQ of the past for any ditto repeat, you also consciously or subconsciously will know that tetralogy of Fallot I have to read in the last 1 month and maybe also in the last 1 week before I sit in the exam. And more often than not, you will find that there will be a significant number of questions being asked again and again from the same topic. So my sincere advice to you is, go through the previous year question. Whatever topic is repeated more than once in the last 4 or 5 papers, read it from your notes, revise it once before your exam, and previous year questions act as the guiding beacon for you, so that you know what are the areas to focus upon. Yes, faculties will be telling you about the important areas. We'll be discussing about important topics to focus and all. We'll be coming out with our own lists in the future as well. We'll be putting on our blogs, on our pages as well. But you yourself can do this practice only by simply solving previous year questions. So previous year questions, please do not neglect them. Having said that, you can't totally depend upon them as well. As Azam sir said, you have to solve other type of MCQs, and you have to strike a balance between notes, mock tests, and your MCQ practice. Now, talking about MCQ practice, sir, I'll like to come to Khaleel sir now. Sir, as we are seeing recently, you'll find a lot of questions in FMGE are being asked, which are visual questions.
Yes, sir.
Image-based questions. There are questions having a chest X-ray image, questions having a rash photograph, and questions being asked upon that. Sir, any tips for the students on that?
Yeah. What we have seen is, especially for FMG exam, the images that come out are very, very standard images, guys. Image-based questions, if you do very routine analysis of what the previous year questions were there, questions on pneumothorax, questions on pneumoperitoneum, right, epidural hematomas, right, and very standard derma images. So don't try to put a lot of energy into trying to learn miscellaneous things. There are some topics and some images to be shown for the understanding of the concept. But what the examiner will ask will be very standard images. You should not miss an image of intersusception. You should not miss an image of Hirschsprung's disease. So when you are looking at the questions of images also, you should understand that he is not going to give you very minuscule images or minor images. He will give you very standard, which is expected of you. So when you skim through the topic, especially the image-based subjects like dermatology, like radiology, like you can easily identify. Like a lot of questions in orthopedics also are image-based these days. The psoas abscess, the giant cell tumor, right? You cannot miss those standard images. So be very calm with the image-based questions. It will be your scoring area. So as everybody have been mentioning, it has to be a proper balance between your theory and your MCQs. And a self-analysis of your test and discussions, your previous year questions is important at this phase. Divide your time 60-40 or 70-30 to balance between your theory and MCQs. And I think if you are committed and focused, feeding positive energy into yourself, I think the exam will be a very good exam for all of you. So stay committed to your cause. Don't panic, and use your analysis, the test and discussions that you do, the subject-wise exams that you do now, the grant tests that you do now, use them as your learning tools, right? Don't use them as your judging tools. These are, you have less mistakes to do on the day of exam if you do some mistakes in your subject-wise exams now, grant test now. So don't just get worried too much if you're not scoring well on this test, and don't skip out on doing exams altogether. So that balance is important. Use them as learning tool. You have less mistakes to do on the day of exam.
Thank you so much, sir. Rajiv, sir, any tips on the last 1 week preparation?
So guys, first of all, you know what, I've got a lot to learn for me also. One thing I would like to reiterate one thing. If at this moment your heart is telling you that I am having pretty imperfect preparation for the examination, may I remind you one thing. All the people who passed the exam till now, they were also feeling the same thing at this juncture a month before the exam. May I repeat one more time, because you may be feeling, oh, I am the single one out over here. May I remind you one more time that if you're feeling little imperfectly prepared for the examination at this moment of time, whosoever has passed the exam in the past, senior batches and all that, has gone through the same kind of feeling in this phase actually. Now, what to do in the last 1 week before exam? When I say 28th May to 3rd of June. So what to do is, you know what, 28th is the time like when you do the first year subjects. Like 27 may be over, 28 may belongs to first year. Like you do anatomy, physiology, biochemistry. When I say one day means 12 hours of dedicated study. Means 2 2-hour sessions and 6 such sessions. Minimum. You have to go beyond it. So when we have got 3 hours to look at anatomy and 3 hours to look at physiology and 3 hours to look at biochemistry, you will be able to touch many important points in your notes. And these, what are those points? You have been reading your notes, and as you did in this month now, you're going to mark those important points in your notes. Now pick up the copy and only look at those parts now. As Khaleel sir said, let us be super selective now. Now the time to be super selective. You know why? You're 1 week before the exam. There is a high probability that if you see something on 28th May, on 4th of June the same question comes, you're able to recall that confidently. Let's go to 29th May. 29th May belongs to second year. 3 subjects. You do pathology, then microbiology and pharmacology. Again, 12 hours study, and let us see all the important points once again. Then let's go to the next one. Then comes the I, ENT, PSM and forensic. When I say PSM, please devote half the day to the PSM. These are like, it's a bigger subject. IENT, 1.5 hour, and then forensic also. That's all. Let us go to the next one. This is 28, 29, 30 that have passed. Now the 31st and 1st belong to the clinicals now, the final year subjects, and you know medicine surgery would take pretty long time. And they're very scoring subject. Let me tell you, surgery is the pure subject. Gynae is the pure subject. You know the questions are coming out of that, and they are really questions which are coming out of the clinical understanding. So if you see that concept of interception, for example, you are able to recall that. So let us give 2 days to the final year subject, particularly medicine, surgery, OBGYN, pediatrics, orthopedics, and a shorter subject. And believe me, this is one strategy I adopted for my PG exam also, and this really worked. Now come the last 2 days. Now the 2nd of the June belongs to seeing all the T&D papers. Let us see all the T&D papers, whatever your institute has given you, whatever you have with you, pick up them and really see all those questions one more time. And the last day comes, 3rd June. The half of the 3rd June belongs to image-based revision. As Dr. Khaleel highly pointed very clearly, images are important. Let us see 4 images, 4 subject images. Surgery, let's see pathology, radiology, and dermatology. Let us see them one by one, and half of day devoted to this. Rest half of the day, I want to leave it to you. You have got some favorite subject which you want to really see one more time, and let's fold hands and go on the 4th of June. May God bless us all with it.
Excellent words shared by sir. And Khaleel sir, I'll be coming to you, and I have 2 questions. One of them is a freshly asked question, like I have the chat in front of me, and one student has just now asked, how many image-based questions sir normally come? Like what kind of weightage we should be giving?
Like different exams have given you different weightage. Sometimes the questions have gone to around 34, 35 also, but the usual trend is around 25 questions, where you'll be pure image based. And nowadays, because of the integrated questions coming in, there'll be a question stem with the image. So if you're looking at your images, you'll be narrowing down the diagnosis much more. So you can expect minimum 25 to 30 questions which are pure image based, and which you can solve by solving the images of all the subjects well.
And sir, something about the anxiety which students tend to have, because one can be very well prepared, but if somebody is anxious just before the exam, we have seen that the performance tends to dip down.
Yeah.
So any tips on that, sir?
It's very important at this time. I would say, have a hope that good things will happen. So this is very, very important. What happens is we start thinking on the negative side in the beginning only. Have a positive hope that good things will happen. Have faith in your hard work that you have done, in your teachers that have taught you, right? And with this kind of mindset, feeding you with a constant positive feedback from the very first day, do not let any negative thought come in, guys. Negative thought will creep up more negativity. A positive thought will creep up more positivity. And the way to overcome anxiety is to start studying. If you are just thinking and worrying about it, it starts getting into a vicious cycle. So see that your thoughts, what you think, that is what the results will end up to be. If you are thinking that the result is positive, you are working towards it, your actions will correlate with your thought process, and you will have a good result. Do not compromise on the sleep. Why I see many people getting too nervous towards the exam is because they think that by studying late in the night they are going to solve this. It does not work like that. Your result is not decided just by whatever effort that you do this month. It is decided by whatever effort that you have kept since the beginning of your preparation. It's the constant efforts, that subconsciously the trained thing that you have happened, right? The exams that you have written, the subject, the classes that you have attended, subconscious thought process that you have developed. All of that will help you on the day of exam when you see the question. So don't compromise on your sleep. If you compromise your sleep, it is going to add to your anxiety and worry. So maintain a proper sleep cycle. Take short breaks in between your preparation. Don't become, locked down into a room, locked down onto your study table completely. And start to smile, start to, relax. It's just an exam. We all will pass. Most of the students have passed. The timing may have been different, but most students have passed this exam. Don't take too much of stress and stay on a positive note. I think, sir, by not compromising sleep, having proper food habits, and keeping positive thoughts should take them forward. And also, we have with us two eminent faculties for two very, very important subjects for FMG. One is ophthalmology, Madam Dr. Shivani Jain, ma'am, and we have our very favorite surgery faculty, Dr. Rajamendran sir, to talk to you about the whole concept, how you should approach these two subjects, especially for your FMG exam, very, very high yield areas for your FMG exam. Ma'am.
So first of all, friends, this was not planned. So welcome to the session. I'm Dr. Shivani Jain, your ophthalmology mentor. And it's a huge response that we have seen that you are here listening to all our favorite teachers, that how the strategy should be. So your exams are approaching. I would just summarize everything in one sentence. Focus on your studies, your target, believe in yourself, study smart, strategically, take blessings of your parents, your well-wishers, your teachers, and success will be in your hand. That's all I want to say. Best of luck from everybody at DocTutorials. We are with you guys. Just prepare and study hard. Okay? So, sir would like to tell you something.
Actually, I'm watching the channel in YouTube. Happy to see they are clearing all the doubts. We don't have anything to speak extra. Only one thing I will tell here. Don't read for exams. You read each as thinking each and every question is going to be a patient in future. That is more important than clearing an exam. So what you are going to learn now is going to save the life of one patient in future. That is what we expect from you. So don't worry about the exam. Exams may come and go, but patient's life is more important. So you have to learn in such a way you are going to save the life of one patient in future. Okay, thank you. All the best for your exams.
Sir, about surgery, especially surgery being such a big subject, what would be your advice?
So surgery, there are at least 50 questions going to come, and I'm 100% sure you are going to get 40 questions correct just by going to the exam. And 100% correct just by seeing our contents from DocTutorials. You can get 40 plus questions correct, especially the rapid revision session we have already added. That will be more than enough for the last minute exam. Okay, so just go cool, see all the images in surgery. Last year we had around 15 images from surgery itself. So please go through the surgical images, photographs, everything clearly. Definitely you are going to crack 40 questions correct in surgery. Okay, thank you. Thank you, sir.
Thank you, ma'am and sir, for this last minute special,
Please
just
Thank
like
you very much, sir. When we are here, we can't miss a chance to interact with the students.
Thank you.
Okay,
Thank
best
you
of
very
luck.
much.
Carry on.
Thank you very much.
it's
There
more
are so
like
many doubts from the students. You
Yes,
have to
yes,
answer
yes.
them. Yes.
just like you have in MCU, Marvel Cinematic Universe, there are post-credit scenes. Now, so you have some special guests coming in. There is
Yeah.
one last post-credit scene which is still pending, and Azam sir will be talking about it because a lot of you, as I can see in the comments, have been asking about if we are planning something special for you? Any revision sessions being planned or not? Sir, you want to enlighten the students?
Absolutely, sir. DocTutorials is actually always along with the students. You can see the entire team in the studio here. We are always with you. We are always concerned about the students there. And even I was saying in the comment section along with Sandeep sir also. So we are actually glad to announce that yes, whatever you're saying in the comment section, we are listening to that and we are on to that. Yes, we are going to come up with 50 expected questions for all the students who are preparing for 4th June 2022. From the team DocTutorials, we are going to come up with the 50 expected questions of all the major subjects. Okay, so just stay tuned, download the app, and just be ready for the next update from the team DocTutorial. So we have whatever you have said, we have listened to that one. Yes, we are always along with you. God bless you all, dear.
Yes. Thank you so much to all the experts who have shared their pearls of wisdom with all of you.
Yeah.
See, end of the day, we can only guide you, we can only advise you. It is your thing. The lesser stress you take and all the basics, all the advice which faculty have given to you, even if you are able to stick to about 80 to 85% of that, trust me, half of the job is done there itself. And many of the queries are still coming. We are trying to in the future also we'll try to
Sandeep,
address as much as possible.
Absolutely.
As
Great.
much as possible, right?
Yeah.
But thank you so much, sir.
One point I would like to add over here, because I believe in that imperfection works in this world. Perfection does not work, honestly. And whenever you feel a doubt that with this kind of incomplete preparation at this moment, will I pass or not? Just recall one senior from your college who had the gala time all through the 5.5 years, who went to all the parties, who did everything possible on the planet, and now the news is even that senior has passed the exam. Please take a screenshot from his profile. Whenever you feel low about your preparation, look at the screenshot and tell it to yourself, if this guy can pass, then I can also pass. The mandate of the FMG exam is not to know everything about everything. It's not USMLE or NEET, PG or INICT. Let's understand what the exam is. The exam theme is, I accept that I do not know everything about everything, but I know sufficient enough to pass the exam. And in this last 1 month, I'm going to complete 2 revisions as per this plan. And may God bless me. May God bless my friends. May everyone pass the FMG exam.
With these great thoughts, we come to the end of the session. I hope everyone benefits from it. Regarding the announcement which we made, very shortly, we'll be coming up with details of these programs, the schedule, the details, who can subscribe, who can see, where you can see. So just give us a couple of days and we'll be out with more specifications. So thank you very much, and thank you, sirs.
Thank you.
All the best.
All
One
the
month
best.
to go.
Thank you.
All the best.
We'll be connected, guys, further.
Thank you so much.
Nice session.
Good sessions. None of the good sessions done.
Well, it was really like everybody's